Hi everyone, good evening and welcome to this evening's Scrutiny Services Review Group. I'm Councillor Lee Bridgen, Chair of the committee. I'll start with the preamble. Um, the meeting this evening will be live streamed to the public. A recording of the public part of the meeting will be available on the council's website within 24 hours of the meeting. Will remote participants joining the meeting via Teams, please turn cameras on when speaking and use the hands up icon to indicate a question or comment. Turn microphones and cameras off when finished. Those in the chamber, please remember to switch microphones on when speaking and speak directly into the microphone and turn it off when finished. With attendees in the chamber, please make sure you switch mobile phones off or place them on silent mode. And if you need to take a call, please leave the room and return when you've finished. I just need to make sure I've got mine on silent, otherwise that would be embarrassing. Okay, so moving on to the first item of the agenda, which is apologies for absence.
Thank you, Chair. Apologies for absence have been received from Councillor Gillian Fry, who's substituted by Councillor Nigel Marshall, Councillor Nazir, who's substituted by Councillor S. Hussain, who's not here currently, she's on her way, Councillor Alia Khan, Parent Governor Rep Ashish Kahida, Katie Thompson and Mark Mailer. Thank you, Chair.
Thank you. Moving on to the next item on the agenda, which is the minutes. That's on pages 5 to 9 of your agenda pack. I'm sure you've all read and studied those minutes. Does anybody have any comments or corrections? No, so I think we can consider those approved. Thank you. So moving on to the next item of the agenda, agenda 3. Item 3, disclosures of interest. I will start by declaring that I am a local authority governor of Summaries Junior School. Any other disclosures? Okay. Moving on to the next item, item 4, urgent business.
Not received any, Chair.
Thank you. Any references from committees and other bodies?
Chair, thank you.
Thanks. On the next item, Chair's update. Nothing. Just like to welcome Linda Hurst from the East London Foundation Trust. And just to inform participants here that Teresa Hills will be joining possibly later online. I think she has a parents' evening this evening and has given her apologies for lateness. That's all for the Chair's update. So moving on to the reports. So the first report is under item 7. That's one of the 2 follow reports. And that relates to access to mental health support services. I think that is with Linda. So if I hand over, thank you.
You've got paper copies.
We've got paper copies.
Perfect.
So
Perfect.
we've got copies, so following through.
Lovely. Thank you. Thank you very much. Sorry about that. So my name is Linda Hurst. I'm the General Manager for Luton and Central Bedfordshire CAM service for East London Foundation Trust. And thank you for inviting us here tonight. My colleague, Dr. Mark van Roosmalen, who some of you will know, is actually on an extended break at the moment. So, but normally we'd do this together. So really we were asked to think about, where CAMs are in Luton at this present time. As I'm sure you're aware from all the national guidance, the increase in mental health, demands for mental health services within children and young people over the past 5 years, certainly post-pandemic, has been quite considerable. One of the things I wanted to talk about was the referrals into the team, how things are done, and sort of the current position of where we are, and then talk a little bit about the impact that we've had from the mental health support teams for Luton as part of the national programme following the Green Paper, and what impact that's having for our children and young people, particularly of Luton. So for those of you who've got the paper copy, I hope you can follow, but if not, as I say, I will circulate it. So thinking about our routine appointments, so our target, from our ICB colleagues, is that young people for routine appointments will be seen within 12 weeks. As some of you will see, we have met that target to 99% since April 24, with a little dip in September 24. So from the back of that, what I would like to add is that from that, 88% in this month of our young people were seen within 4 weeks. So they're being seen much quicker than within that target period. And as I say, those are routine cases. Obviously, we have young people who go into crisis, and they are seen certainly within 4 hours. And I'll talk a little bit more about that later. The chart on the left obviously is about our key performance indicators, and that's just to give you a little bit of background around that. In terms of referrals into Luton CAMS, back in the financial year, April 19 to March 20, pre-pandemic, we received 1,466 referrals into our service. That increased slightly during the pandemic, April 20 to March 21, to 1,615. By 21-22, that figure was 2,612 and levelled off to 2,800, 2,750 in 23-24. And then last year, from April 24 to March of this year, 2,784. And those are just purely for routine referrals into the service. In the last 6 months, we've had not quite on 1,400 up until September of this year. What is really apparent is the referral routes into our service. So back in 2021, we started accepting self-referrals into the service. But the majority, historically, CAMS has been young people would go to the GPs, and the majority of our referrals were from GPs only. And in the last year, 24-25, 39% of referrals received into CAMS were from schools. And I think that indicates the impact of the mental health schools teams across Luton and the support of partnership working with our colleagues in education. Only 17% of referrals into CAMS were from GPs. And again, I think that's testament to the work that we've done in partnership with other health colleagues and indeed obviously the local authority to think about, young people accessing at the most earliest stage. And as I was just saying, 9% of 9% of referrals were from self-referrals. I think, again, what that demonstrates is that the increase we've had in investment for mental health in schools teams, and which is continued because actually we're getting another team in January 2026, which is really good news for for Luton, that we have been able to, get young people into the service without reaching that intense level. So really about building resilience and about early intervention, which is something that we're very proud of and that we've been doing in Luton for many, many years. Obviously, I'm sure you're all aware of our access rates, part of KPIs for access rates into CAMS. And in 2024-25, 2,515 individual Luton young people accessed CAMS. From April to August, that figure is 1,311 access service to date. And for those of you who are not familiar with how the access rates work, the measure counts for each young person within each financial year if they've received one direct, so face-to-face, or indirect appointment. Now, a young person may have multiple referrals into CAMS, but it would only be counted once per financial year. So that's just something to bear in mind. Obviously, one of the things we want to do is continue to improve our access rates. We've set up monthly consultations with our colleagues in Luton Social Care. We have regular consultation meetings with our MASH colleagues. And we've had a quality improvement project over the last 2 years, working specifically on improving access to our South Asian population within Luton. And what that has proved that actually we've sustained an increase in referrals from 15 to, well, nearly now 20% of young people within that population accessing our services, which is, it's really, really helpful. It's helpful for obviously the families themselves, but also for the wider community. We are lucky in Luton to have the EPEC programme, which stands for Empowering Parents, Empowering Communities. And we have trained 6 parents across the town from different nationalities and from different cultures to work with us to support, access for children, young people within the town. We've recently gone through a consultation period for our CAMS access service, which really is about making our model much more locality based, and we're working with colleagues from LBC on the whole neighbourhood model and what that might look like going forward. And some of the things that we've done there, we've had lots of drop-in sessions using our family hubs as the base and working closely with other places to develop that presence. At the football club, we just entered into some work with them and the faith communities. And as we go through the next sort of period of time, we want to really think about how we can work perhaps with more faith leaders and that kind of arena, so we can really think about that. The other thing I just wanted to say is, apart from our core CAMS services and obviously working with colleagues in social care and education, as most of you will know, we now have finally our inpatient unit in Luton. So for our very unwell young people that do need inpatient provision, we can work closely with our colleagues at Evergreen to keep young people at home and to keep stays obviously close to home, which obviously aids recovery. We also have our county-wide eating disorder service, and as some of you may be aware, there's been a large increase in the presentations of eating disorders, both in terms of numbers and complexity since the pandemic. So that's just a snapshot of some of the things that we're working on. And if anybody's got any questions, I'm happy to answer. And if I don't have the answer, to come back and to ensure that that's the case.
Thanks for the report and your explanation. I think one of the questions or maybe concerns that I have is in relation to, these are great figures in terms of the waiting times for first appointments, but do you have metrics on, I don't know how you term it, start of treatment? So presumably there's a first appointment and then whatever treatment or intervention is needed is decided. Are there metrics and KPIs around time from the initial appointment to when the treatment actually starts?
Yes, that is correct. I think what we could say, I don't have those figures actually with me now, but again, I could circulate that. I think what we pride ourselves on trying to make the transition, the journey for the young people the best. So they would have an initial triage sort of within 7 days, and then they would have that assessment and say the majority then have been within 4 weeks. I'm realistic that from this. But that is part of the treatment plan. So some assessments, may take 2 or 3 appointments to really think about what it is we want to focus on. And obviously we would develop care plans along with parents and carers and think about what that looks like. I hope that answers that question.
Yeah, thank you. Any questions from Councillor Marshall? Yeah.
Thank you. Forgive the ignorance of my questions, so I don't normally sit on this panel. But what I did pick up on 2 occasions, is that you referenced coming out of the pandemic that numbers of referrals have increased. So is that due to the fact that people couldn't get treatment during the pandemic period? Would be my first question. And my second question to that is, as we move away from the pandemic years, do you anticipate that number reducing to pre-pandemic levels? And again, apologies if they are really naive questions, but I'm very interested. Thank you.
That's absolutely fine, thank you. What I would say is that pre-pandemic, obviously, we were still working on the same premise to get the young people seen as soon as possible. As I alluded to in the figures there, we were 1,300 and up to about 2,800 referrals. That is the national picture. And actually, I think there's been lots more, the pandemic obviously had a real impact on young people not going to school, and obviously, the whole family dynamics around that. But I think, it started to level out over the past 2 years. I don't think we'll ever go back to pre-pandemic numbers. And, there's been lots of research done, on a national phase to say that that certainly is the case. And I think the complexity of some of the cases that we now see that we didn't see before. And obviously, the pandemic not only had all the health implications, but also, the current financial climate that we're living in has got a real knock-on effect to families and how people are managing. A multitude of factors, not just the pandemic. And of course, thank you, my colleague here. But obviously, the environment that people live, the young children are living in. So, young children will come to us and actually, with a presenting problem. But actually, there's the whole holistic, what can we do about housing? What can we do about, parents who have got mental health conditions themselves? And, it's the whole picture really, rather than just, we're not about it's the child's problem. We want to fix the child. Actually, we want to work with the whole system in order to, make that child as resilient and, to be the best that they can be.
Councillor Begum?
Thank you, Chair. When I saw this report, I was pleased to see that this has come, but at the same time, I counted the pages and I thought, is that it? Because I was expecting a little bit more. You've quoted some figures, which is great. You kind of say that these are the number of people that are seen within 12 weeks, and this is like their first appointment. Obviously, we know that nobody really gets diagnosed at the first appointment. However, there's many hurdles a person has to face before they get to that first appointment. So it'd be interesting if we had a bit more information of what that journey was like. And I guess for me, in particular, what interests me is because I work with young people. I've had a very stressed ADHD child today. I say child, young person, because he's not a child. He will tell you he's not a child. And it'd be interesting to kind of see a little bit more in terms of the figures. What are the age groups of these young people? What are the gender as well as ethnicity? I know you say that this is the percentage of South Asian people, but even within that, there's a breakdown that can be done. Because if we're looking at, you said we want to take a whole systems approach. To take a whole systems approach, there's so many different elements that you've got to look at, as well as for sort of family, schools, communities, and all of those wider context. So it's kind of like, it'd be nice to have a bit more of a breakdown in terms of all of those things. And I think maybe postcodes would be a useful tool to have in recording some of this information. Then we can kind of see, is it in our most deprived areas that we're seeing most of these problems? Are they perhaps children that are looked after children? Are they not looked after children? Have they been known to the system in other ways or not? And what is the best way? Because I hear quite often from a lot of the young people that I work with that they don't like CAMHS. CAMHS has got a really bad reputation, and it's a shame because I see from the inside the work that you do and what you strive to do and achieve, but of course the young people don't see that, and what they see is that they get bad service, they don't get listened to, and they just don't feel understood. So I see both sides. So I think for me, it'd be interesting to get a bit more of a breakdown so that we can perhaps understand a little bit more about what's going on. But I do welcome the fact that you want to do a whole systems approach, because there is a lot, like you say, a lot of things do affect young people. So for me, I think I would like a bit more. So I don't really have a specific question, because I don't think there's enough there for me to be able to specifically say to you, can you tell me how many of these people are from what XYZ postcode, for example, or what is the gender? Because there's not enough information there, and you may not have that at hand either.
Certainly, I'd be more than welcome to either provide that or come back to another meeting, with that breakdown of figures. It's statistics that we have to provide. Obviously, we work in conjunction with our colleagues in CCS around the particular ADHD pathway. I could easily go back to Charterhouse and say, click this button. We've got this many young people in this age group and that age group, different, and we can break it down certainly but even by schools. We can say how many young people from that school are accessing our service.
And also about the sort of journey before the first appointment, because it's not always at the first appointment that somebody gets an assessment and they know what's going on, kind of thing.
But I think, with the introduction of the MHSTs, and now with Luton having a named CAMS worker in each school, I think that's where a lot of the work is going on. So actually, I think, to answer the gentleman's question over there, I think CAMS is plateauing in some respect, because we're doing much more work much earlier on within the school system, and working with our education colleagues, within the school settings, which includes special schools as well.
In terms of the demographic question, is that something that you'd be able to maybe provide as a written response?
Yes, certainly.
That'd be helpful. Thank you. Cheers. Councillor Hussain?
Thank you, Chair. Apologies, first of all, for being a bit late. Thank you for the report. My question was just around escalation of maybe more severe cases. Is there a procedure? Is there any numbers? Obviously, or does it all have to go through that 12-week process, like you said? Because obviously some cases could need that earlier intervention.
Yes, certainly. As I was saying earlier on, we obviously have a crisis service. We provide services till 9 o'clock at night for crisis, young people in crisis. We work closely with our colleagues both at Luton and Dunstable and Bedfordshire Hospital. And we work with schools so that if actually, a school is worried, we have a clinician of the day every day, Monday to Friday. They can contact CAMS and say, we've got this young person we're worried about. We can have a consultation. Our crisis team have gone and do go on regular occasions to school, or if, to work with that young person, or if children are presenting at A&E, as they do, our crisis team can see them up until 9 o'clock at night, Monday to Friday, and from 10 till 8, Saturdays and Sundays.
Sorry, thank you. I might have missed it because I did come in late. Also, I agree with my colleague around the breakdown of whether EHCPs looked after. It'll give us a broader picture, and again, postcodes, schools, even just to show us a bit more of a varied picture of where more of the support might be needed. But thank you for that.
And just to add to that, if I may, alongside the crisis team, we have a home treatment team. So they will go and work in homes with families. So it may be a young person who, because we try and avoid admission wherever possible. And we know that, the statistics and the research that actually the sooner you see a young person, the better. But for those young people who are acutely unwell, we might do 3 or 4 home visits per week, including weekends, to support the family throughout those very difficult journeys.
That's great. When you say home visits, is that do you ask the preference of the child, whether they prefer it at home or at school?
That would be sort of the home intensive treatment. So those children who are particularly unwell. But we do work, we're not just based in Charterhouse. We see young people in schools, in community centres. We try and work with the young people, see what is best from them.
Thank you. Any other questions? Dheeraj, you want to come in?
Thank you, Councillor Bridgen. Linda, I think we've Probably, my sense is the ask from Scrutiny might have been taken literally about access to mental health services. So I can see that the report has tried to deal with the initial access bit. And given that there's some further information that's been requested, could I just add to that list for future scrutiny? Could we also tie in some of the information around the transition from children's mental health to adults' mental health? Because I know there's a huge amount of work being undertaken around the transitions pathway. I'm also curious about the targeted work that CAMHS are undertaking with those children that are refusing to engage with CAMHS, but as professionals and parents, we know they absolutely need it, because those are the children that won't access it at home, won't access it in a CAMHS clinician's office, won't access it in school, often aren't in school, to be able to access it. So, and I know that Elfton are trying, and schools are trying to do outreach work to try and reach those really, really difficult situations, traumatized situations as well. So actually being able to bring something really meaty to demonstrate the work that's happening would be really helpful for scrutiny.
And again, my colleague Mark van Risman, he's been doing lots of work around just trauma informed and delivering training to colleagues in LBC, you know, to sort of, you know, think about that, because again, we know that that's, you know, that can damage young people for a long period of time.
Thank you. Councillor Adris?
Thank you, Chair. I just want to understand, obviously, given us figures for how many children have access to services, how many cases are actually completed in the financial year? Because obviously we know how many people are accessing it. A lot of the children have got complex cases. Some could take a long time, some could take a short time. Obviously, looking at the figures from April to August, 1,300 children have already accessed the service. So a significant increase from last year. So I'm just a bit concerned that, you know, the system might get bogged down a little bit.
So in terms of the referrals, that's obviously for half a year. So that's what I'm saying. I think it would be platted out, you know, by the time we get to March next year. I mean, what we do collect is how long young people are in our service for, how many sessions on average, you know, a young person would have. And, you know, again, we can break all that information down. I think what, in answer to your particular part about, you know, how are we, sorry, I lost my train of thought there. How are we sort of engaging with that group? You know, there are lots of forums to be able to do that. And I think some of the work that we've been doing with parents, and particularly around the parents who are part of our EPEC programme, they're really helping to demonstrate that, not just within particular cultures and particular areas, but across the town completely.
Councillor Begum, you had another question?
Yes, thank you. Thanks for coming back to me, Chair. Just as Councillor Latif was talking, I was curious as to what happens to those children that don't quite fully meet the criteria to have a CAMHS assessment, but are kind of borderline. What happens to those young people?
So obviously the work that we're doing in schools is to work with those young people that may not meet that sort of threshold for core CAMHS, which is why we work on the you know, the tiered system to think about we work the iThrive model, getting help, getting more help, and the 4 quadrants of that. And again, that would be something that I could circulate to yourselves. So there will always be something for them. I think it all depends on a case-by-case basis. And lots of consultations with colleagues in schools.
It's just that obviously young people are really, really clever. And some young people get so accustomed to their needs that they know how to camouflage because they know what normal looks like. And therefore they don't always get picked up. So it's whether your ways of testing and sort of assessing can identify those sorts of things. Sometimes you don't see it first time round. It might take multiple assessments or multiple times of meeting a young person to identify that actually there's a bit of a change in behaviour when they meet you, whereas somewhere else they're different. So do you do that kind of cross-referencing with schools and teachers?
Yeah, and I think that I was saying before, it's that holistic. It's about the whole system around around the young person. So, you know, we may assess a young person in clinic and say, okay, well, what's going on in the school, and contact the school, you know, or get the parents' view. We go to schools and do observations within schools, particularly in the younger age group, and the work we're doing with our Flying Start around the 0 to 5s and that kind of thing. So there's lots of, you know, other avenues rather than just the young person coming to the clinic, having an assessment, thinking what therapeutic input is best suited for that individual.
Thank you. Any other questions, comments? No? Okay, so I think, let me open the correct PDF. So, yeah, so the recommendation was to note the presentation and ask any questions about support available, which we've done. So, thank you for your responses. And yeah, we look forward to obviously the responses to the written responses to the questions raised earlier as well. Thank you.
Thank you.
Great. We'll move on to the next item of the agenda, which we're reverting back to the main agenda pack. That's item 8. It's the Luton Safeguarding Children Partnership Yearly Report from 2024 to 25, which is on pages 10 to 87 of your agenda pack. And that is with Dheeraj. Thank you. Thanks, Dheeraj.
Thank you, Chair. Good evening, members. I'm not intending to go through the entire report. It's a very lengthy report, and I know that members will have read and understood it, and so we'll move to questions fairly quickly. But just as an introduction from myself, this is the report before you is Luton Children's Safeguarding Partnership's yearly report for 24-25. And as that year suggests, it covers the work of the MASA arrangements between April 24 and the 31st of March of this year. As you'll know, Safeguarding Guidance, Working Together to Safeguard Children 23 sets out the Safeguarding Partners yearly report expectations, which is about providing transparency for children, families and practitioners about the activities undertaken by Safeguarding Partners in the previous 12 months. It sets out what the partnership has done around the multi-agency safeguarding arrangements, including the learning and improvement of the children's arising from local child safeguarding practice reviews, previously known as serious case reviews, and how effectively the arrangements have been in practice. The yearly report should also be reflective of the work undertaken during the previous financial year and it's supposed to be submitted by the end of September 2025. I can confirm that this was achieved. The independent chair role changed under Working Together 2023, which was the implementation was expected to take place by the end of last calendar year. And the role changed to that being of an independent scrutineer. The independent chair role now sits with one of the 3 statutory safeguarding partners. And as you'll know, that includes social care, police and health, and specifically the designated safeguarding persons within these organisations. The LSCP collectively assigned the role to local authority social care, that is myself, for year 1, which is 2025, which has now been extended to the end of March 2026. The report therefore covers both pre and post my taking over as the chair. You'll note from the report that the LSCP identified strategic priorities from that previous year, which includes early intervention and prevention and collaboration, education and safeguarding, data utilization analysis, mental health support, exploitation and missing children, neglect, learning from reviews, cross-border collaboration, and voice of the child. In addition, the local child safeguarding local safeguarding children's partnership shares a joint responsibility with the Safeguarding Adults Board and PanBed's Children's Partnership on the issue of domestic abuse. This report, as I've already said, covers the areas of activity for 24-25, and all that's been achieved through strong partnership working. It also signals the identified and agreed priorities for the following year, which will be reported back to CSRG around this time next year as well. As I said at the start, not intending to go through the entire report, But Sancha, who's in the chambers behind me, and Bev, who's online, are also present for any questions that members might have.
Thank you. And again, before I open up to the floor, I've got a quick question. So just a quick question on paragraph 13, obviously, he's alluded to the need to secure equitable proportionate funding contributions, which is obviously key. So my question would be, which of each of the statutory and I guess relevant agencies, what would each of their kind of contributions be, and for 24, 25, 25, 26, and what shortfalls would remain against the programme, and how would any shortfalls impact that programme?
Thank you, Councillor Bridgen. So if I just pick up the broader question, and then I'll turn to Bev for some finer details. So just to reassure Scrutiny, there's been no gaps around delivery of Safeguarding Partnerships priorities for 24-25. The issue of funding split between statutory partners has been and remains a challenge nationally. The guidance from the DfE, Department for Education, and Working Together doesn't stipulate specifically what that expectation should be. However, it states that contributions to safeguarding arrangements should be equitable. However, it has thereafter clarified that their version of equitability doesn't mean financial contribution being equitable either. However, that is a conversation that carries on both through the Safeguarding Partnership and the Safeguarding Assurance meetings that are chaired by the Chief Exec of the Borough. I think in terms of the split between organisations, I'll turn to Bev to see if there's any further detail that she can provide, and then we can come back to just discuss what the implications of that is. However, it's suffice to say the local authority does bear the larger proportion of the costs to the safeguarding arrangements.
Thank you, dear Urgent Chair. So in terms of the percentages, the local authority currently bears a proportion of around 50% of the total cost, with the health providers, and that includes the ICB, ELFT, the hospital and Cambridge Community Services, covering about 39%, and the police have increased their contribution slightly to around 11%. In terms of what that would mean, if we did move to an equitable position, which, as Diraj has explained, it doesn't mean that they're the same, but if we were looking for it to be exactly the same across the partnership, it would be around £88,000 each. So it would be a significant increase from the position that they're currently in, given that they don't pay anywhere near the amounts that the local authority pay. As Diraj has set out, there hasn't been any shortfall. We have managed to achieve everything that we set out in terms of our priorities, delivering our training, undertaking our child safeguarding practice reviews locally, undertaking audits, and other key work that is required by the local Safeguarding Children Partnership. So hopefully that provides some clarity, but if there's any further questions, please do ask.
And just to add to that, where there's been further need for funding, and we have a partnership agreement of sorts that says that should, for instance, we have additional safeguarding practice reviews that require additional costs to be incurred, that would be split between statutory partners. And that has, and I turn to Bev for just confirming that I'm correct in stating that where that's been needed, that's been achieved.
Yes, thank you, Diraj. That has been achieved. We haven't needed it this financial year, but we have in previous financial years where we've had more than we anticipated in terms of child safeguarding practice reviews. As you appreciate, as it's on a case-by-case basis, it's very hard to predict the number of cases that will meet the criteria for a serious incident notification and then become child safeguarding practice reviews.
Thank you. Thanks very much. Any questions from the floor? Councillor Beacom? Yeah.
Thank you, Chair. Thank you all for the report. It is a really detailed report. Just an observation, a lot of the figures are from 2021. Why is that?
I don't know if, do you have any specifics that you might just draw our attention to? And then I know Bev can probably
Yes,
answer.
so
more
on
broadly as well.
page 31 onwards, you kind of talk, you've got breakdowns of population, economy, employment, education, housing, so on. But most of these figures are 2020 or 2021. On housing, you've got a housing price increase since 2015. It'd be better to have more accurate figures, I personally think, because then it paints a better picture of what's going on. So I just wondered why we are using some quite old figures.
I don't know,
So,
Bev, if you wanted to come in.
yes, thank you. Yes, so in terms of those figures, those are the figures that are made available to us through the observatory and through public health. Obviously, in terms of some of them come from the census, and we use the most up-to-date figures that are available, that are obviously validated and can be used as comparators nationally as well. You'll see that in some of the figures that we look at data across wards, how we stand across other local areas and comparators with central beds and Bedford Borough, which obviously we conduct our pan beds arrangements with.
If I may come in, Chair, as well, just to add, thank you. Sorry, I've just found where you were looking, Councillor Begum, so thank you. Luton and numbers is the section. So when the priorities for 24-25 would have been set, that would have been towards the end of 2023. So the Safeguarding Partnership would have set the priorities for the following year. I believe the Luton and numbers JSNA is undertaken every so often. So May 2023, which is when that set of figures were captured in order to set the joint strategic needs analysis and therefore the services that needed to be identified and arranged. That's what the Safeguarding Partnership would have relied upon. What I would probably add is that for 25, 26 and beyond, we would use more up-to-date figures. They again wouldn't be as of yesterday. They would need to be as recent as they possibly could be. And generally speaking, they tend to be as up-to-date as and are able to give us a relatively strong sense of the needs of the borough.
And the other thing I wanted to, well, there's two other things actually I want to say, and I'll keep it short. Where you've got some information and data about wards, it'd be interesting to have all the wards rather than just a select few. And I can't find the page anymore, so I'm really sorry. I can't point you to the page number. It was around that section that I was looking at earlier. And the other thing I do want to ask about is on page 35, where you talk about education and safeguarding. As much as we say that we've trained up teachers and we've trained up schools and we're providing them with the support to be able to deal with and identify safeguarding issues, as a person that works in education myself, I don't think that's always the case, because as much as some people might get told that this is what we got to do, some people are stuck in their ways and therefore may not follow through or have a different idea of what safeguarding looks like. So, I mean, today I had a comment from one of my students, and it kind of made me reflect a little bit in terms of us teachers, what we do with our young people. So when one student says, "You actually really care," and I was like, well, why wouldn't I care? A student was feeling lightheaded, done going in and out the room, noticed that she'd gone out and not come back in for a good amount of time. So I asked a friend to go and get her from the toilets. And she came back in and she said, "You really actually care about us, don't you?" And it was the fact that, does that mean teachers don't generally care? And she kind of explained throughout secondary school and obviously her earlier year in college, she just felt that teachers just generally don't care. We're so focused on statistics and numbers, and where you've got, yeah, it's rated good by Ofsted, that means nothing to me, because it is SLT driven. this good standard is always SLT driven, that we've got to have 100% achievement. And if you're not achieving, we've got to put, all these sort of things in place to be able to combat a behavior or a situation that is beyond that person's control. So is there anything more that you can perhaps push towards to kind of get schools and educational professionals really to work a little bit more and gain a better understanding? Because I think I went to one of the trainings with, I can't remember your name, sorry, the lady at the back, a while ago with social workers, and that was really interesting. I think a similar model of training that's suggested to teachers would offer them a better insight of actually what's going on with a young person and broaden their sort of understanding, because there is a generation gap. There's always going to be a generation gap, and things have moved on so much. So I think sometimes that sort of model of training would be helpful for teachers as well, because it helps us identify things a lot earlier before things get really, really bad and out of hand.
Thank you, Councillor Begum. So, and it's a really important issue, and I want to also say, thank you for reaching out to that child when that need arose for that child. There are many reasons children might feel unloved, excluded, but by and large, my experience has been that teachers in Luton do genuinely care, and I visit quite a few of our schools quite regularly, and I see that in action. I can't speak to every single situation, and I can also imagine some of the more trying situations can leave us as adults needing our own space. But it's important as professionals we're able to take that into a separate space. Two things I would say in response to it. We, as a sector, have been pushing to make education a fourth statutory safeguarding partner. And whilst working together, 2023 didn't go as far as that. It has recognised the need for education to be on the table. And as part of that, our new multi-agency safeguarding arrangements for this year and onwards is putting a much stronger focus on education being an equal member on the table, even if under the eyes of working together, they are not named as statutory partners. We are starting to see a real difference, and that engagement, collaboration, joint working is making a difference. The other piece of work that we've started to introduce across Luton schools is therapeutic thinking, which is similar to trauma-informed ways of working, recognizing that children's behavior isn't just behavior, it stems from somewhere, and how we respond to it. And Linda was talking about that earlier around health services responses as well, and mental health responses. And that's starting to show some real strong, again, inclusive practice within our schools. We want to get that right across all our workforce in schools, and we're working through that. 765 odd schools, we're getting through it. And I did say two things, but I'm going to add a third thing. The third thing for me is you're absolutely right to say, the expectations of schools from Department for Education and Ofsted has always been focused around attendance and attainment, and that can sometimes serve as a perverse incentive for schools. What the new inspection framework from Ofsted now does, and you'll have seen the report that came to scrutiny previously, is moving away from single word judgments and actually making inclusion really, really important. And therefore, schools will be held to account around what inclusive practices are they putting in place for children like that young person that you supported to feel like they were cared for and their teachers cared and their institution cared for them.
Councillor Marshall.
Yeah.
Thank you, Chair. It'll be another naive one from me. I'm subbing for Jill tonight. But I mean, first I want to say thank you for what you do. Reading the report, it is, for somebody who's not really close to it, is very, very enlightening. So I think you add value to lots of people, children and families across the whole of the town. So thank you. My question again is going to be really naive. So you certainly have a budget that you work to, but to deliver what you wanted to do as a collective, as a team, how many more millions of pounds would that take annually for you to do what you would like to do as a team?
You're right. Loaded question.
Intrigued. I would like to know how much money you have to play with to begin with, if that, if you are able to share that. But secondly, to deliver what you wanted to deliver for the community here, and I know money's tight and it has been for years. If you were able to pick a figure out, how many more millions would it be?
The council's budget and Children, Families and Education Department specific budget is published. It's not a secret. So our budget is in the region of about £70 million per year, and that's the core budget under General Fund for Children's Services or Children, Families and Education Department. On top of that, we have a designated schools grant, which comes in to the local authority to administer, however, goes straight out to schools. Within the designated schools grant, there is a high needs block element, which pays for additional needs and high needs for children and their educational needs. Your question about what needs to be added to that is an interesting one. If I had a magic figure, I would absolutely state it right now. I think there's been a recognition nationally that there's been sadly underfunding for children's services departments up and down the country, also unhelped by the austerity measures that the government had to put in place earlier this, I'd say about a decade and a half ago. And that's had a challenge for local authorities. To add to that, Luton has faced additional challenges and was particularly affected by the pandemic and the impact on the airport and some of the funding streams from the airport. So that collectively has left us in a position where, as a result of that, the needs for children have become more complex. And we are dealing with some of those complexities that will continue to affect us over time. So I can't quantify. I'm sorry, I can't quantify a figure. However, the government, so just thinking about children's social care specifically, in 2022, the now Minister for Children, Josh McAllister, produced a report called the Independent Review of Children's Social Care, and recognised within that report that in order to reform children's social care, there needed to be, I believe the figure was in the region of £2 billion national investment. And Luton was identified as a pathfinder organisation to take forward the reforms, and we were given a pot of grant funding to enable us to test out a new way of working, which we've successfully implemented, and now we're supporting other local authorities to implement as well. I think government recognises that this is a high need area, and they need to continue to fund it. Luton has received some additional funding, and there's talk of a 3-year settlement, which we're waiting to hear about, I believe, next month. The figures will be made available to us, and that'll give us a sense of whether that starts to fix some of the gaps that have been created over the years. On top of that, there are SEND reforms on their way, and the government again has promised to invest in that arena. We've had some capital funding around increasing school capacities and particularly SEND space capacities, but actually that needs a system reform as well. And of course, I can't comment on that because the white paper hasn't been released yet. I believe that's now been delayed till the new year, and hopefully once that's out, we'll be able to bring that back to scrutiny for further discussion as well.
So a feeling of restrained optimism, would that be a fair summary of it? Looking at what's in the pipeline, what you know within your industry and what's coming forward for you?
Yeah, absolutely. I mean, our biggest challenge areas for children's services departments has always been placements. What we need is more foster carers. What we need is less profiteering by private companies. But we also know, and Linda talked about this earlier in her report as well, complexities are increasing. And as a result of those complexities, some of our children need some real care and attention. And one child's need can suddenly have a massive impact on a children's social care department's budget. These costs aren't small. I'm optimistic. I think early intervention and prevention is the answer. I think we need to intervene early. We might not see the impact of that early intervention for years to come, but we need to start somewhere. And some of the work we've been doing under Families First is starting to address that. But again, we might not see the impact of that for a few years to come. We have to be efficient, Councillor. We have to be efficient. We have to be innovative. We have to think about cross-departmental, but cross-agency working better. So where mental health and social care needs are presenting for children, there's domestic abuse, there's substance misuse. We as an organization, as a system, need to come together, and we are doing that better now than we have ever done before. There's more to do, and we'll keep improving in that area. As we do that better, we can pool our funding, pool our resources together, and I think we can make a real difference. So, I do believe that. And I feel encouraged every day when I come into work and I see some of the positive impact that our staff make on the ground.
Councillor Begum?
Thanks, Chair. I think that was a bit of an unfair question to ask to put a number. I just feel it's a bit unfair because I think we've got to work with what we've got and deal with the challenges that we have in front of us. At the same time, I think, Dheeraj, you're doing absolutely the right thing by looking at where can we get extra funding, what is available out there, and what can we put ourselves forward for. So I think you're doing the right thing. And this report is great because you're touching on every single basis. So when you all talked about this systems approach, it's evident in this report. You can see it coming together, and it is a much better report than what we've seen in the past. So I do think that it's great. And it's great to hear that there is more money coming, but like all our services at the moment in the council, everything is stretched to the brim because the needs are so extensive and complex, like you say. So I think, to put a ballpark figure on anything at the moment is never really going to be the answer or solve any of the issues. I think what we've got and what we're doing at the moment and what we are aspiring to do, that's where we should be focusing. Thank you.
Tasleem Aslam?
First of all, I just want to say, what phenomenal work you do. Just page 37, that child safeguarding cases 2019-25 got my attention. And I just looked at the data 2023 to 2024, got a sudden surge. Any particular reason?
Yeah, thank you. And can I just,
Curious.
yeah, absolutely. Can I just also just go back a couple of points and say thank you for the plaudits. The team's worked incredibly hard, but particularly Bev, who's the business manager, has, I think it's her real passion and drive that's brought the partnership together and produced the report that you see in front of you. So I just wanted to make sure that that was acknowledged. Yes, 23-24 did see a significant surge. You're absolutely right. Without going to too many specifics, this followed a very tragic incident in Luton, and where a child died through stabbing. And I think this is known to Scrutiny because we have discussed this here before as well. And as a result, it required us to consider the implications of that death on the other children that were involved. So whilst the other children themselves weren't directly harmed, they were involved in an incident of harm, and we have to consider what learning there is for them as children themselves. Whilst they may have been involved in a criminal activity, we always start from the position of they are children first. That requires, under the law and under the statutory guidance, rightly so in my opinion, that we undertake a rapid review and undertake the learning from that. There was a group of children involved in that space that required this response.
Councillor Hussain?
Thank you. Yeah, I agree. It's a very comprehensive report, very detailed report. Just going back to, there was talk earlier around maybe schools not doing enough around, what was suggested. What support are we providing the schools? I know you said there was some trainings. For me, I feel I work in a school as well, so I feel teachers are quite quick and staff are quite quick on picking up noticing things and then signposting them to the relevant departments. But there's only a certain amount they can actually do until they have to get other agencies involved sometimes. And then it's like they have to support that child within that period. So is there anything else that is planned or they could access?
I'll invite Bev in to respond to that, Councillor Hussain.
No, thank you for that question. I think one of the things that we do need to acknowledge is that in terms of referrals to our multi-agency safeguarding hub, year on year, the majority of them do come from schools. I think it's around 27.6% of all referrals over the year, contacts and referrals, come from schools. So schools are making in the region of about 3,100 referrals a year, and that's been quite consistent. So I think they are recognising when young people need support, and particularly when it is a child protection matter. In terms of the training, within Annex A, which has the data snapshot, there's a training report in there, and you'll be able to see the trainings offer. We have a very strong training offer. We work with our partners in Bedford and Central to have safeguarding Bedfordshire training. It's very accessible. There's a blended approach, so teachers can access a range of free e-learning courses. I think the catalogue currently sits at around 360 different subjects for children in particular safeguarding circumstances and for their families. And we also have a significant programme of courses that are run either virtually or face-to-face. And they run from a safeguarding awareness. There's designated safeguarding leaders training, the working together, which is one of our core courses, which is multi-agency to support people in working together. So education comes as part of that multi-agency piece and understands then how the partners work together and how that support is formed around the child and their family. So there is, a really comprehensive training offer in Luton. We promote it. And we do webinars, so we do lunchtime, lunch and learns, we do after schools. We also do an overview of our Safeguarding Bedfordshire website, so that where you've got new members of staff coming on board, they have the opportunity to look and see what our offer is, because it's not just training, it's information. And we do also have an escalation protocol, resolving professional disputes protocol, which means that schools can have a conversation, either with a safeguarding education lead within children, families and education, or they can put cases of concern into the local safeguarding children partnership where they're not content with the response they've received. So it is very robust and comprehensive.
Thank you for that. Has that been shared with the schools, I presume? That appendix, I must have missed it, sorry. But has that all been shared with, or is it, do they have to,
It's all part of the report. The report is published publicly on the Safeguarding Bedfordshire website. On the Safeguarding Bedfordshire website, there are links to the training offer. There's links to different subjects for safeguarding, and if it would help, Councillor Begum, I'm quite happy to arrange a short Teams meeting with yourself just to take you through it, and then you can share that in your school if that would be helpful. And any other councillor who would like to see what there is available, I'm very happy to do that.
That's very kind of you. I'll get in touch with whoever else would like to take that offer on. Thank you.
Thank you. Just another question that I found actually. On page 48 of the agenda pack, don't know whether it's not a specific page number for the report itself. There's reference to the section 11 and the eight parameters that were last assessed in full in 2017. What were the sort of weakest areas in of those parameters from 2017, and are we confident that in the assessment in 25-26 that those will be improved?
So
Thank you.
yes, sorry. So the last time it was looked at in 2017, and it was reviewed, as you said, across all 8 standards. We actually had it as we do across a PAN beds, because most of our agencies do work across PAN beds, but with obviously, we do have a Luton place-based focus. And we had an independent reviewer come and work with us to identify areas. One of the areas at that point was around voice of children, as well as the awareness in single organisations of their safeguarding responsibilities beyond having information around things like having a designated safeguarding lead. And it was very varied. So we had some agencies that had really strong, robust responses. Many of those were the statutory safeguarding partners. Obviously, the law has changed since 2017, and we moved into multi-agency safeguarding arrangements. Following several revisions to working together, we've had a focus on themes. So we've looked at a number of themes. I think last year we particularly looked around how well are we working with neglect against the standards. And this year we have already started planning for our Section 11, which will take place. Partner agencies will collate their evidence from now until the 31st of March, and then they have to present that back to the independent scrutineers, who by the time we have the meeting to look at where we're seeing real areas of strength and areas of practice we want to replicate, and where our gaps and challenges are, that they will have heavily scrutinised the information received. And what they will be expecting to see is evidence of impact, not just saying, well, we have a poster on a wall, for example, but actually demonstrating how it's made a difference for children, and how they're strengthening everybody's approach, that safeguarding is everyone's business.
Okay, thank you. Any other, Councillor Latif?
So thank you, Chair. So I also want to echo my sort of congratulations and well done for the work that you and the team are doing, Diraj. I just want to have a little discussion around page 74, and obviously the changes around to where Health Watch are obviously contracts being terminated, I think March time, and then work to do with sort of mental health. What sort of impact that might have with that sort of gap in service, or how you provide provision for that going forward?
I'm checking to see if Bev wants to come in on this question as well. So the query is Health Watch Lutonshire. So examples of programs and initiatives across the partnership under the section around engaging children and young people to hear their views and lived experiences in particular. So I don't know, Bev, if you were able to answer anything specific around that area.
Thank you, Diraj. We have made really good use of Health Watch in their current iteration. Now, as we're aware, it's not just Health Watch where there's changes to the modelling, there's the ICB remodelling, NHS England. So we're having a real focus on how do we continue with that good practice. We are still working with Health Watch. We're still using their expertise and working to a child and adolescent parent violence and abuse audit action plan, and looking how we can develop those tools. And they are currently a member of the strategic board for the Safeguarding Children Partnership. But what we will be looking for is, as this is part of the government remodelling, is how we close any gaps, reduce that, ensure there's no barriers for people to being able to tell us what their concerns are about safeguarding. So we will continue to work as we have done, gathering the voice of children, families, and carers, etc., and thinking of other ways of getting that voice in, and making sure that within the ICB remodeling that they are meeting all of their statutory requirements, because that's being rounded up. And we're currently receiving assurance pieces from the ICB around how they're going to meet all of their safeguarding responsibilities going forward.
Thank you. Any other questions, comments? Don't see any hands raised. Thank you, Diraj and Beverly, for that. The recommendation was to note the findings of the report, which are duly noted. So again, thank you for that, and thanks for your hard work, as already mentioned earlier. Okay, so moving on to the next item of the agenda, which is item 9, which is the adoption annual report. That's another one of the to follow items, so it's not in the main agenda pack. I just need to find it myself. There it is. And that's with Marcella? Marcella, yeah, thank you.
Thank you. Good evening. I will just summarize. This is the adoption annual report for 24-25, and Luton is part of the Adopt East Alliance, which is really well embedded now. However, Luton stands as an adoption agency in its own right. The report goes through our prospective adopters, and as you will see from a larger number of inquiries, 58, we had 6 approvals in that time. In relation to our children, we had 1 child placed with consent, which was previously known as a relinquished child. Very helpfully, 5 of our children were placed in early permanency, which means they were matched and placed early with prospective adopters as their foster carers before they were adopted. We had 21 placement orders, and we had 9 children adopted in that period. The support available to families that have adopted is through the Adoption and Special Guardian Support Fund, which has reduced nationally, but there is still a percentage available to local authorities, and we identify the needs of children within those adoptive families and make those applications. We also have a commission service through the Alliance with Adoption Plus, which really supports birth parents that have their children adopted. And I suppose one of the key areas of the last year has been the modernisation agenda, which is really working with courts and considering really maintaining the relationship with birth families. Now, we do still have a long way to go before we get to open adoptions, but it is work in progress. So I will pause there if you have any questions or anything you want me to go into in more detail.
Thank you. Before I call on Councillor Keynes to ask his question, I've got a quick question, and it's in relation to the early permanence or fostering to adopt. I think in the key priorities, it mentions to increase the number of duly approved adopters for early permanence. I guess my question is around, I know that always comes with its risks, that you don't go from the fostering to the adoption. So I guess my question is around, in terms of the recent cases of early permanence, have they all proceeded to adoption? And though it's a great thing, is pushing it, increasing the risk somewhat of there being the I guess problems with the transition from fostering to adoption and actually not getting to the adoption stage?
Yeah, no, that's a really good question. So it can be really challenging to persuade prospective adopters to be duly approved, not least because they are actually taking some of those risks that a baby or a very young child would be placed with them, for example, at the beginning of care proceedings, and then a decision may be that adoption is not in their best interest. And that may be because the assessments of the family have shown improvements, or there are other family members that come forward. I think where early permanency is probably easier and more successful is when an adoptive family has adopted a sibling and there is another sibling, then we really reach out very quickly and approach those adopters to consider being duly approved and taking that child much earlier.
Thank you. Councillor Keane?
Actually, you've just spiked my guns. You asked a question I was going to ask. I will ask one question, well, two or three actually. Adopter inquiries, it's gone down considerably, and it's supposed to be nationwide as well. Any particular reason? Has anybody thought why?
Yeah, it certainly has gone down nationally, and we've seen that at a local level as well. I think there were a number of reasons, not least because I think the stories from prospective adopters about some of the challenges, particularly in adolescent years, and perhaps some of the more high-profile adoption breakdowns that get into social media much more now. I think that probably has made quite a significant difference at a national level as well as at a local level.
Are you going to get over this?
I would say for us locally, the recruitment of prospective adopters is a real priority for us, and we do want to reach out to all of our communities. I also think in terms of, just really thinking about different communities have different stories about adoption as well, and different views about that. And we do need to do a lot more work actually within our communities, both in terms, we've talked a lot about that in relation to fostering, but we also need to do the same in relation to adoption.
Yeah.
Sorry, I think Dheeraj wants to come in on that as well. So.
Oh.
Thank you, Councillor Keane. So just to add to what Marcel has already stated, I think nationally we've seen a reduction in both fostering and adoption inquiries post the pandemic, and post coming out of the pandemic as well. What we did notice is through some concerted effort and work with our Adopt East colleagues, which is our regional adoption agency, that number of inquiries and number of approvals have increased since the last reporting period to this most recent reporting period. And there have been some real success stories as a result of that concerted effort and some added priorities being put in. What I would also say, and Marcel has reminded me quite regularly, is actually there's a huge push governmentally around connected persons, kinship care, and recognizing that children are best placed with their families wherever safe to do so. So there's more of a push around recognizing actually what more could we do with the extended family network where adoption might not be the right decision for the child. However, there's somebody else in the family that can do just that. And I think we will start to see a bit of a change in some of the adoption inquiries, adoption approvals, adoption cases. It will start to settle down over the next few years as we get into a new way of working around connected persons, kinship care, assessments and placements of children with extended family members as well.
Yeah, okay. I think what you're really saying is there's not enough children to really want to be adopted. Is there a shortage of children? You know what I mean, for adoption? Oh, somebody answer.
So I think picking up on that point, I think what's really interesting looking at the national picture in relation to that, I would say for the last 6 years, you can see a really dramatic change in terms of children living in the southeast and in London, moving much more towards special guardianships and kinship care. And what you see is that is moving up the country. So there is that real shift to supporting families and supporting children to be in their family placements. However, what I would also say alongside that is there has been a dramatic drop nationally and for us locally as well. We've seen that in terms of the number of prospective adopters coming forward. And not only that, particularly the number that will take a break between phase 1 and phase 2 and may not decide to come back to the process for stage 2. And again, that's a national trend as well.
Yeah, phase 2, big reduction. And I appreciate you have to put a lot of things in the way to look at what's going on. Is it possibly not too difficult to continue from stage 1 to from stage to stage 2?
So I would say the adoption assessment process is a complex one. It does involve a lot of reflections in terms of yourself and your background. So I do think for some people that may have come into the process thinking it may be more straightforward, they may actually find particularly the stage 2, which goes into a lot of detail, and really starts to, because it does have to be very in-depth to really think about both the motivation for adoption. And I think the other thing that's probably quite interesting in adoption and adoption assessments is they often involve a lot of loss. So you often have families coming into that process where they haven't had opportunities to have their own families and have experienced quite a considerable amount of loss, which all has to be worked through as part of the stage 2. So I think for some families, they realize that maybe they're not quite ready for that.
Sorry, can I? Right, well, do away with that side. The courts. Is there a problem with a hold up in the courts? I know there is a great backlog at the courts at the moment. Are you finding it difficult to actually get a session?
Yeah. So I think what's really helped post COVID now is that care proceedings are moving quicker, and you will actually see in next year's annual report our timescales have really improved from children becoming looked after to the placement order being made and the matches being made. So you'll really see the difference next year, because we're already seeing that. It is still it can still take longer than we would want to for the adoption order to be granted once children are matched and placed, and that some of that is about prospective adopters making the application, but some of that is also about courts availability once they make the application.
Yeah, that's encouraging. It'd be interesting to see next year's report. I do know the courts are actually sitting on Saturdays at the moment, so they should be sorting themselves out. Thank you.
Councillor Beckham?
Thank you, Chair. Just a quick question on page 16 at the top, where you've got down that during 2024 to 25, that 17 children had been placed with adoptive placements, but only 6 of those 17 children went on to achieve adoptive orders during the same financial period. Why didn't the others receive it, or what is the reason for only 6 achieving it and not more than 6?
Yeah, I think that's when children are placed, there is a period of time that they have to be placed before the prospective adopters can actually make the application. So this report cuts off at March. So of the 17 of those placed, depending on the length of time. Yeah.
Any other questions? So the recommendation, I think, was just to note the report, wasn't it? So, yep, that report is duly noted. And again, thank you for the comprehensive report and your responses to our questions. So we'll move on to the next item. Let me get to the right agenda pack. Right. So again, the next item is the fostering annual report, which was one of the to follow items, and let me open that up. Where is it? There it is. Okay, so yeah, so item 10, I think that's with you again, Marcella. Thank you.
It is, thank you. So the fostering annual report 2024-25, just again to highlight some of the key areas. I think in summary, 2024-25 for our fostering service was a period of where we needed to take stock and to do quite a lot of restructuring internally, and I suppose rather than some reshaping of our services, because we recognized that we really needed to think about how we support and retain our foster carers. So we did have our first celebration event for our foster carers during that period. And we've also subsequently had quite a number of both fun activities, but also activities where we are really trying to bring our foster carers and their children, including their birth children, together, and really listen to them and what they're saying to us. We did a lot of different recruitment activity during that period. And we recruited 4 new general foster carers. But we recognise that we have a lot more work to do in that area, and that is a very specific area of focus for us. Um, um, and you will see some of those differences again in the annual report coming forward next year. I think what has been important as well is that as part of that reshaping internally, we separated out the fostering recruitment team from the kinship team. So they've now both got more capacity to be able to deal with those really important aspects. One which is recruiting more foster carers, and the other is both recruiting and supporting our kinship carers. We've done a lot of work in terms of really trying to co-produce with our foster carers, but also have our care experienced young people and our children in care giving us feedback, as well as birth children, in terms of what their experiences is and what they want to change. And that has helped us to make the recommendations for this year, which we are currently on track to achieve.
Thank you. Again, before I open it up to the floor, I'll come over to you, Tasmin, in a moment. I just have a quick question. The report, and apologies if it's covered out elsewhere in the report and I haven't seen it, but gives quite a good breakdown of the ethnicity and religion and so on of the children looked after and foster carers. Obviously, children in foster care have been through a great deal of trauma and so on. And one of the, I guess, the key things to hold on to is the sense of self and the sense of, you know, their heritage and so on. So, and again, apologies if it's in there, I can see it, but what percentage of children are actually placed with foster carers of the same kind of heritage and so on? Do we have those figures?
Yes, we do have those figures. I don't have all of those figures at the top of my head, but I suppose what I can say to you is that not all of our children are placed with foster carers from their same ethnic background. And when that is not the case, then we want to really ensure that we are supporting both our children and the fostering household. And that's whether they are our foster carers or whether they're independent fostering agency, to ensure that that their racial, cultural needs are met, and that we are supporting them to do that. Just to add to that as well, in the last 6 months, one of the things we've really noticed is so we are seeing some changes to our children that are becoming looked after in the cohort. So we are seeing quite a significant reduction in the number of white children that are becoming looked after, and an increase in the number of children of mixed parentage. So Black children of mixed parentage becoming looked after. And we're also seeing a reduction in the number of Asian children becoming looked after. And the age ranges of the children are changing as well. So we're having more in the younger age groups and less in the teenage groups. And we have developed a new marketing and recruitment strategy, which has much more targeted focus on recruiting foster carers from those communities.
Thanks, that's great to hear. So if I understood that quick, so where the parents are not of the same, sorry, the foster carers are not of the same heritage, they're kind of, dare I say, mentored and given help to help the child sort of embrace and maintain their heritage. That's really good. Thank you. Apologies, over to Taslim Massam. Thank you.
You just said that you are now developing a more targeted and focused strategy to recruit. And my question was actually on recruitment. What is it that you are doing to recruit?
Yeah, so I think what we've been doing.
Sorry, I'm just so rude to interrupt, because I know of many families, people that want to adopt, but they can never be signposted or find information. I know of many colleagues that would love to adopt. They have the capacity, they have the space, but it's navigating and finding this information is very difficult.
Can I just clarify, adopt or foster? Because I think you mentioned adopt, foster. Okay.
Okay. So please do contact me directly. If yes, if we have families in our community that want to foster and are finding it difficult for whatever reason, and I know because we're part of the Foster East Alliance and we have the hub that does all the initial processing, sometimes that can be challenging. But if there is any way that we can really help be out in our communities and help to explain and guide families through it, we are more than happy to do that. And I think that's the difference that with our new recruitment and marketing strategy is we want to move away from the general marketing at all of the events. We will still continue to do some of that, but we do actually want to spend more time in communities, and also really spend time in places where people gather as faith communities as well, and really spend our time talking and understanding and helping them through the process.
Diraj?
Thank you. So, and I think I just want to give a specific answer to the query about how families that have space and are willing, keen, able to foster. So the immediate answer is just putting fostering in Luton in Google will direct them. The challenge we've sometimes got is private fostering agencies will have a better search result on search engines. And sorry, I mentioned Google. I'm sure other search engines are available. But what I would say is if they put that in, they will find Luton Borough Council's fostering page on there. If they click on that, that will direct them to the phone number and the brief inquiry form. It's very, very, very easy, very quick to respond, to put their information on. They will be contacted, and we have the agreement through Foster East that they will be contacted within a certain amount of time. And we are keen to hear from all those families. And if there's any information we can send your way as well, or you can pass on to those families, which is why Marcella is a great contact as the head of corporate parenting, please do reach out to us. And as Marcella has said, we're doing a range of different things to try and target better. I'm sure we can always do better than what we've always done, so always keen to learn.
Thank you, Diraj. Yeah, just to add that actually, while I was thinking here, I did do a search with the aforementioned search engine, and I think the first sponsored result that comes up is Foster East, which would then direct to Luton Borough Council. So yeah, thank you. Councillor Bigham?
Respectfully, I think Councillor Keynes was waiting before me, so I'll go after him.
Oh, thank you. Councillor Keynes?
Right. Do you intend to have any more stalls in the Arndale? No, Point, whatever it's called this week. And I'll follow on from that in a minute.
So the question is if we've got any more stalls at Luton Point, which is the shopping centre. So I know we've certainly got some posters up against the lift entrances, but we're trying to do much more than that. Any sort of activities that take place across Luton, whether there's a fun fair, whether there's a particular Luton supported fete organised, we've got a stall present. The fostering team, marketing team is present wherever they're needed, and will do so as regularly. We certainly, when we have big conversation meetings, and I know that there are some being set up for this month and next month, we tend to have a very clear, simple leaflet for fostering, phone number, email address available, and we do give it out to families as well. So the question, Marcella, was, do we have a specific stall set up at the shopping centre still?
Not all the time, but during specific events like Fostering Week, or if there are specific events going on, we do put a stall in there. So we don't have 5 days a week in the shopping centre.
Right. I'm just wondering if these stalls are great. I've seen them. If people might be a bit too embarrassed to actually contact and speak to you, I wonder if it's possible the new wellbeing centre in the island at the Point is enclosed, and you've got a room where you can actually go into it. I'm just wondering if possibly you could have a look and see, try using that.
I think that's a really good suggestion, and we will definitely take that forward.
Do I get paid for that?
Well, if you do refer somebody and they end up being approved, there is a payment for that.
Oh, right. Do I declare an interest? There was another question. I can't remember it now. Oh, yeah. The other thing is the mockingbird. I know you've told us about this before, but
Yes.
what is it?
Okay, so the mockingbird is effectively like a peer support. So you have a host foster carer that doesn't actually have any foster children placed, and they support a constellation of foster carers. And effectively what they do is they offer support groups during the week, but also they have times where those foster children spend time in their homes. So it provides respite opportunities. And it's really an opportunity for that whole constellation to work together and to support each other. So we've launched our first mockingbird constellation in Luton. Is that clear? I can see you.
Are they a base then, a hub of sort? Where are they?
They're in their own homes. So the foster carer, that's the hub carer, will invite the other foster carers into their home because they don't have any foster children. So they remain vacant. They don't have any foster children placed with them. So they have the opportunity to have overnight stays for the other foster children in the constellation. And then they invite the foster carers around for coffee, for information sessions and general support sessions.
Yeah, sure, Diraj, yeah.
I think the idea for Mockingbird is to create a family, an extended family set up for our children, because often otherwise children can feel quite isolated, being looked after by a family without that wider connection. And as Marcella said, the approach enables us to have almost as a mentoring carer that can then support the other foster carers as well. Yeah, and Councillor Keynes would be very happy and very keen for any member to come and visit some of our foster carers, and particularly our home hub carer, to learn more about this. And I know that certainly we bring more information to our corporate parenting board as well, where this particular area is thoroughly scrutinised, and it'd be really great to have more members present there as well.
You could give that information to the members of the committee, and well, thank you.
Thanks. Councillor Bigham.
Thank you, Chair. I have three questions and I'll ask them all together because otherwise I'll go on forever. Page 32, in terms of your organisation structure. So you've got like the new current structure. Just wanted to ask about this structure. Does it work a lot more effectively than the old structure? Because you've got a number of people in post, you've got quite a few part-time people in post. Does that actually work effectively? Does it work more efficiently? And in terms of productivity, is it a lot more productive in terms of getting through cases and caseloads and so on? So that's my first question. Second question is relating to page 35. Down the bottom where you've got sort of like an ethnic breakdown of foster carers. That's more of a comment. I'm quite pleased to see that there is an uptake in sort of ethnic minority people in terms of fostering. However, obviously we've still got a bit more work to do in terms of getting other ethnic minorities involved. So I just want to know what are you going to do about bringing some more people in? And then my final question on page 36, towards the bottom, you've got that, I think I missed out a question. Anyway, towards the bottom, you've got, you say that 33.1% live more than 20 miles away from their home address. Just wanted to know in terms of the impact on the children, and do they get to come back into town regularly, see friends and family and so on? And are these children mainly, just wanted to know whether they had EHCPs or disabilities or what that kind of breakdown looked like. So those were my three questions for now. Thank you.
Thank you. In terms of the structure and the effectiveness of it, it's certainly working more effectively to have the recruitment team and the kinship team split, because I think because a lot of the kinship team work as well can be court mandated. So that was taking priority over recruitment, which is just as important. So that's much better. In terms of the ethnic background and the gaps, and particularly, as I said, recruiting more from our Black African, Black Caribbean communities. We have a lot, so we're doing, I suppose, two quite specific things. One is reaching out and going into communities, including churches. And the second is we've got some excellent foster carers from those communities. And we are really developing and embedding those foster carers as champions, so that they can help us to reach out to those communities as well. And your final point in relation to the percentage of children that live outside, that is definitely something we want to improve on. That's also linked to us recruiting more foster carers, so that we have more and they live closer. Yes, they do have regular contact with their families and they do come back in to Luton to have that. Yeah. Is that all answered?
Thank you. Any other questions? Councillor Latif first and then back to Councillor Keys.
Thank you, Chair. So I just wanted to, Mashallah, take you to page 36. I just don't understand the rationale, the correlation between, we seem to go more male children in foster than females or young girls. So it's 40% to 60%. So there's a 20% difference. So I can't understand what the correlation is. I mean, the population is pretty much mixed. No?
Yeah, and we generally do tend to have a difference in terms of gender as well as ethnicity for children that become looked after. So yeah, so there is that difference, and that also difference according to ages as well. and certainly for the older age groups, we do have more boys and young men becoming looked after than girls in the different age categories.
Councillor Keynes.
Mine's more of a comment than a question, so you'll be relieved. I think we underrate our foster parents. I really do. I think they're a gem. They really are. They do an awful job in some cases. And I'm just wondering if some way this committee can forward our thanks for everything they do.
Thank you. Really appreciate that and absolutely agree and concur. They are amazing, ordinary people doing extraordinary things every day. Yeah.
Thank you. Any other questions or comments on this item? No? Okay, so again, thank you for the report and for responding to our various questions. And again, that's noted. So the next item is more of a for information item. It's the forward plan. If any of you have any suggestions for items in future meetings, do bring them to my attention. We have got 5 items for the next meeting. Well, the 6th item is the work plan, which is just a more for information, not really a substantive item.
Our usual moan.
Yeah.
I think we've got too many.
Yeah.
On the 19th of November, you've got 6 items there.
It's 5 substantive items and then the forward plan. Again, I have a pre-meeting with the officers, and it's quite possible that you know, some of these items or one of these items might be moved back to another meeting, and so yeah.
I'm not suggesting we delete things.
Yeah, I'm not deleting. No, you wouldn't be deleting. We would be moving to another date if we do. Yeah, we tend not to delete things.
Sorry, Chair, may I?
Certainly.
We were, excuse me, sorry, members. We were going to have an information item for the continuous improvement plan for the November one, and then bring a more detailed one in January. So that was just for more information rather than a substantive report. And I don't know if we could perhaps move the IRO report, because there's also another report that's come on for representation from the Youth Council. That's a report for November.
Hiroshi, do you want to come in on that?
Just to confirm, Councillor, we can pick that up at the pre-meet. I believe there's one coming up very soon. And there may be some things that just need to be clarified from the forward plan.
Absolutely, yeah. So we've got our pre-meet on Monday, although I'm not sure. I think you mentioned that maybe we've had a couple of apologies for that due to half term. So I don't know whether we might need to reschedule our pre-meet, but certainly we can cover that in the pre-meet. Yeah. Yeah. Thank you. Good. So that's finishes our business for today. Thanks everyone for your input, and yep, enjoy the rest of your evening, and we'll meet the next time. Thank you. Cheers.